warm welcome to all the people present here, our board members, inspiration for this initiative on student entrepreneurship, Dr. Shivram, our chief guest for the evening, Dr. Arvind Chinchure. Sir, I have the mic in my hand, I will speak. My distinguished jury members, founders of startups incubated at AIC SEED, and dear aspiring student entrepreneurs and friends. It gives me great pleasure to welcome all of you for this idea pitch event. This is the third cohort of AIC SEED StEP. So what does StEP imply? First of all, what does AIC imply? AIC, Atal Incubation Center, it was the first step which IISER Pune took 5 years back. Reflecting on the journey since the last 5 years, we have taken many small steps. Some of them were kind of successful, some were not so successful, but over the 5 years, what we realized it, if you have a goal and you start proceeding towards that journey, there might be some detours, but you will make progress. And that's what entrepreneurship is all about. During this last 5 years, I'm so happy that we have been able to support 60 plus startups in their journey. And out of that, 30%, nearly 18, are having a connection with IISER Pune. So when IISER started AIC with the support of Atal Innovation Mission, they gave us this mandate that encourage students of science to explore entrepreneurship. Easier said than done. Students of science, totally different DNA. As we realized during our earlier 2 cohorts, 2 batches of science and technology entrepreneurship, you know, students of IISER Pune, you're unique, right? So what is it that inspires you to explore whether you can take your idea from the lab to a product or service in the market? During the earlier 2 cohorts and as I said, our other initiatives, we realized that different things incentivize different students. Also, students of science, especially students of science at IISER Pune, they have a totally different schedule, different constraints. It's not like any other college student in the country. They face different challenges, academic responsibilities. So that's how we decided, with the help of CSR partners, our special thanks to Deepak Nitrite and Expanded Polymer Systems, for supporting us in this initiative, where we said we'll support students to explore how to pursue an entrepreneurial journey. It's not necessary that a startup comes out of it, but what's important is you should have the courage to come and stand on the stage, boldly express your idea. Consider that this idea has the potential to make it big. Convince people. These were some of the aspects that we thought we would like to offer to students of IISER Pune. Sir, I'm happy to share with you, we had 23 entries this time. Over the last 1.5 months, 12 teams have been shortlisted. They came and they were mentored by Ashwin and myself, and they kind of polished their pitches. Some of them went out, met external potential customers to kind of validate their idea. My dear jury members, I have to share with you that please, in the next 1.5 hours, when you listen to these innovative ideas, please remember that they are flavored with the optimism of youth. They have not yet met the harsh ground realities of the business world, for which AIC SEED and StEP is there to support them anyway. And my dear friends, I would like to draw your attention that the jury we've selected this time, they are founders of startups, entrepreneurs themselves. And mind you, all these startups are not more than 2-4 years of age. In this period, they have gone through the grind, the hustle. They know what is it to become an entrepreneur. And they have been successful in raising funds from the government, from the industry, how many pitches they have to make to convert one such opportunity from 100 attempts. So with that, I would like to once again welcome all of you, and let's enjoy today's experience. let us all really aim to uncover the potential that we, each one of us, has. My dear aspiring StEP fellows or aspiring entrepreneurs, each one of you is a winner because you are going to come here and pitch. Okay? This is a zero-sum game. Remember that it's not that the first 3 teams, they are winners. It's not like that. All of you, whoever is interested, is welcome to be pre-incubated at AIC SEED, and we are there to support you. We are there to find opportunities for you to take your idea ahead, provided you are committed towards it. Okay? With that, I would like to once again welcome you and thank you for joining us today. Now with that, I would like to request Dr. S. Shivram, who's been our mentor and the founder of AIC SEED, I must say, the champion of student entrepreneurship, to address us and share remarks.
Thank you, Shweta. A warm welcome to the members of the jury. I appreciate your taking your very valuable time to come here to be a part of this initiative here. To all my young colleagues here, I don't know why some of you are sitting so back at the rear. Some of you come in the front, okay? So be part of the crowd, okay? Don't go back at the back benches. In a classroom, I know students want to sit at the last bench because they feel the teacher won't ask them a question, okay? But here, I think we are not asking any questions. Like she said, it's just a opportunity for you to learn, to appreciate, to understand, and to gain. And there's nothing to lose here. Thank you, Shweta, for that small introduction. I think we appreciate all the great efforts made by AIC SEED to kind of bring in this this kind of an enthusiasm amongst our student colleagues. We have close to 1,300 undergraduate students in the campus, but I think we see only a very small number here, which means that our message still has to go deeper and farther. But I think nevertheless, those of you who are here, you can be our ambassadors, and kind of tell people that why don't we have so many activities in the campus. As students, you are part of many activities. This is one more such activity, except that this activity is something that engages you in a different format, and the good thing about this activity is that if you are lucky, you can go places, I mean, and you can go places where you have never imagined you will ever go, and that is the opportunity which very few learning experiences offer. A lot of learning experience are linear. You will finish your first year, second year, third year, fourth year, get some degree, and then go on. But there is nothing which is basically a disruptive or an exponential growth which occurs, and this is an opportunity which is completely disruptive. You can, in fact, there are cases in the history of entrepreneurship where the people have quit their studies, and gone on to do great things in their life. Okay, all right. I mean, education is a necessary thing, but it is not sufficient. Okay, and so you need to. There are people who have 2-3 years down the line, they found a better calling, and they said, why get a degree? We don't need a degree. We can do better things even without a degree. And that's true. Degree is, sometimes not necessary for doing great things, and but I'm not saying you should quit your degree, but I'm just saying that that's a kind of calling that comes, when you are pursuing opportunities which are non-linear. Linear opportunities go step by step, but non-linear opportunities are few in life. But if you take it and you make something out of it, you will reach a place that you never imagined you would have been otherwise. Otherwise you would have thought about a very linear process of growth and realize suddenly that That's not the only way to grow. Good. So I think this is a great opportunity. Spread the message around. There is, she said, I think very rightly, it's a zero-sum game. You don't lose anything in doing this. On the contrary, if at all, you will gain immensely. And this is just like playing a game. In a sports. It's exactly like it's a sports which is a mental sport. Okay. So good for you that all of you are here. I hope that I hear some very exciting new ideas, and I hope our judges are here to stimulate your thinking and to grow. But more than anything else, if you have an idea, never let it go. Okay, stay with it. Stay with it. Come hell or high waters. Okay, because that idea that you have today may not fructify or mature tomorrow or day after, but you never know. It will come back to you after 5 years or 10 years. Okay, so stay with a good idea. Never abandon a good idea. If there's a good idea, figure out a way to stay with it. And the longer you stay with it, the better you will create opportunities from it. Nothing that you don't spend a few thousand hours will benefit you. Okay, so stay with your idea. Figure out how to stay with it, because that's not easy. I know you got all other commitments that you have to do, academic commitments, and therefore you have to somehow figure out how to stay with it. By the way, this is true also in everything. In research it's true, in business it's true. If you find some good idea, you have to stay with it. You have to figure out how to stay with it, irrespective of what the external environment is. How much difficult it is externally, you have to stay with the idea. And I think what AIC SEED can do is to help you stay with the idea. Okay, if you want to. If you don't wish to stay with the idea, nothing we can do. Okay, but if you think that you want to stay with the idea, I think AIC SEED can help you to stay with the idea, build it brick by brick, a little step by step, she writes here, and hopefully one day it will explode into something that, as I said, you have never imagined. Okay, so that's the promise, and that's the hope. And I hope that I have seen in the past people come with lot of enthusiasm. They make great presentation. After 1 year, after 6 months, they are lost. They are no longer there. That means the first elementary quality required for an entrepreneurial state of mind is not there. Because if you are giving up after 6 months, obviously you are not fit to be an entrepreneur. But when I say entrepreneur, not a business, you don't have the entrepreneurial bent of mind, and therefore you will not even have the same ability in other areas. Because ultimately everywhere the staying power is what makes a difference between success and failure. It's ultimately the staying power. If you stay long enough, you will see success. If you give up so soon, you will not see success. So learn to stay with a good idea. Learn to persist. It could be slow. It could be very, very slow. But you have heard the very nice story of a hare and a tortoise, right? So a tortoise can win the race. The only reason is because that tortoise is steady and moving ahead, with a goal. And a hare can lose a race, So please understand that staying with the idea is important. So please, whatever you present today, if you believe in that idea, stay with it. If you don't believe in that idea, this presentation is of no use. So I hope that all of you believe in what you are presenting here. And therefore, if you believe it, stay with it, success is sure to come. Good luck to all of you. As I said, there are no winners or losers here. Everybody is a winner. So I'm sure that you'll all do well. Thank you.
To initiate the session officially, I would request you to just just space here. One more small request. Please let's honor our jury members for coming here today.
Thank you, Dr. Yogesh, for joining us today. and enriching this ecosystem with your insights. Let us give a big round of applause. So please. I invite Mr. Rahul Juvare, founder R3RR Eco Solutions. All the four are part of our AIC SEED. Yeah. I invite Mr. Amrit Anchan, founder of Thermonics Energy Private Limited. Amrit drove all the way from Mumbai to join us for this event. I invite Ms. Nikita Soni, founder of NLAC Materials, who is one of the founder of the youngest startups at AIC SEED, recently awarded by the GREAT scheme under Ministry of Textiles. Thank you, Nikita.
Without any delay, let's begin with the pitching for the evening. So just few ground rules. Each team will get 2 minutes to present, and the Q&A will be around 3 minutes. So my colleague, Mr. Pradeep, will show a 15-second card that's remaining time. So you'll have to wrap up in 15 seconds. That's what it means. Okay? Sure. So let's go to the first team. Sasye, Adya and Sumukh, please come.
Esteemed jury, what you have in front of you are news articles on some major issues such as anemia, cognitive impairment, night blindness, etc., which affects a lot of children globally. But what do all these issues have in common? They're all consequences of micronutrient deficiencies in early childhood development. Can you believe that when a child does not receive just a few milligrams of micronutrients like iron, calcium, magnesium, etc., they can suffer from such serious disorders? And that's why parents and the government employ techniques such as fortified food, supplements, baby cereals, etc. But none of these take into account actual absorption and competition among these nutrients. To give you an example, spinach, which is known as a superfood, has only 5% bioavailability. That is, 95% of its nutrients go into waste. At Sasye, we are trying to build a powdered sachet that can be added into your toddler's meal to improve the absorption of these micronutrients present.
To achieve this, we're employing several different targeted techniques as shown below. All of these techniques are backed up by scientific papers and credited professors who are our mentors. Now, the solution that we're employing, to explain it a little better, if you are going to add sasay to spinach, then vitamin A absorption increases up to 5-fold. So we have a massive market and a first mover advantage for our solution since we're mainly focusing on bioavailability. This is also validated by the surveys that we have conducted. We initially want to get into B2B and B2G licensing of our core formulation, after which we will get into D2C sales. The societal and healthcare benefits that we provide are immense. We help to combat India's high hidden hunger index and many preventable diseases. In fact, we can be employed at a national and global level in multiple schemes such as midday meals and UNICEF sprinkles. I'd like to conclude by telling you all that Sumukh and I have a combined expertise in biology, social media management, and even freelancing, which makes us a great team for this particular venture. Thank you.
So great pitch. Can you tell more about the testing and the validation part? Because you have developed some product, I guess, but whether you have validated how much absorption it is improving based on the data?
So we actually are just in the idea stage. We don't have a prototype as of now. We do have a few techniques that we have looked up through scientific papers, which we can combine, and essentially we need to make a composition formulation and then we can test it out.
But to get your point, these 5 ingredients that we have used, we have spoken to professors, and we actually have research papers which actually show how much improvement in absorption they have. So we do have validation that these ingredients do work in improving absorption. We just need to combine them in the right ratios and develop a product.
Okay. Thank you.
Yeah, hi. Great pitch. I want to understand that if tomorrow, the product, what we are wanting to do is great. If tomorrow a big company wants to launch this product, what defensibility do you have against them? Like, what will make you seem different to them?
So right now we have an opportunity for a composition IP, where we can go for like the different ratios of the ingredients that we use. We can IP that, and with that we can have some kind of defensibility to in the market.
Okay. Okay.
So, couple of questions. I would like to know more about the surveys that you conducted. Second is, what are other companies are doing? I assume this is a big market, so companies must have launched product commercially. So, can you share more details on that? So, survey conducted and who are existing competition?
Okay, so the surveys that we conducted were on urban parents who had children around 1 to 5 years of age. And if you can see there, the stats show that 40% of them are very concerned about their child's nutrition. But the interesting
Talk more on a sample size.
So it was around 30 people that we surveyed over call and also through Google Forms. And once we, mentioned and educated them about bioavailability, their concern increased by around 20%. We also looked into factors that they were concerned about, like cognitive development, growth gain, and all of that. So the vitamins that we chose, vitamins and micronutrients, they cater to these particular issues very well.
And about the existing products, so we have, firstly we have Ceregro, which is one of the most popular products. These actually do not cater to bioavailability and absorption as such. When I went to the ingredient list, they showed a lot of rice flour and refined flour and all those things, which have phytates, and phytates are known inhibitors of these micronutrients. If we talk about Gridso does account for the bioavailability of calcium, but it does not account for any other nutrients. And there has been studies actually which shows that calcium absorption, like if you increase calcium absorption, it inhibits the iron absorption actually. So we are trying to build a product which can simultaneously improve the absorption of all the micronutrients present, because they're all important. And Little Joy is also same. They're also focused on nutrient intake rather than absorption per se.
Just one question. How do you ensure that the product is safe?
Right now, as I said, that we have studies on the individual ingredients, and they show that they are safe to be used in. They are actually regulatory approved ingredients. Or what we have to test, we have to mainly do in the R&D is conduct stability tests, that they are stable together, and whether they have good shelf life and things.
Do you need a clinical trial for this?
If we show enough evidence, we have evidence for individual ingredients. So since we will need to conduct basic trials like in vitro and rat studies maybe, but it's not compulsory for us to do human trials at this stage.
Thank you.
Thank you.
Next team already. Nikhil and Somnath, please.
Hi. So over 1 billion people around the world are affected by vitamin D deficiency. And if it's left untreated, it develops into rickettsia, osteomalgia, osteoporosis, and several immune disorders. Now, in human body, 85% of the vitamin D is coming from sunlight. The rest comes from diet. And as you know, Indian diets are mostly vegetarian. Vitamin D even goes low. Now, as per the study, people who work outside, like when they are exposed to sunlight, even they are vitamin D deficient. 48% deficiency for outside workers, you can see in the green, and people who are working indoors will be vitamin D deficient. So this leads to a hidden pandemic or an epidemic of vitamin D.
Since we are science people, clinically it is called as hypovitaminosis D, and there are two ways of treating it. One is you take pills or either go for phototherapy. So there are 3 companies that deal with phototherapy, that are Darwin, Waldman and Philips, but all of them treat disease but not deficiency. So there is another company called StEP which actually claims that they can treat vitamin D deficiency, but you can look at the cost, no average Indian can afford that. That's where we bring in our lamp called as Aura D, which is a LED based lamp. It works at 293 nanometers, which has been clinically proven to increase twice the amount of serum vitamin D levels. And next, there are 4 important key features of that lamp. It automatically switches between UV to white, so that even if you forget, there is no hazardous impact of UV light on you. Next, there is AI dosage control. It actually checks how many people are there in the room, then based on which it actually calculates average amount of intensity that is required for the entire room. Next, we also have an IR sensor for scanning the depth of the skin, because people in the room can have different skin types and skin densities as well. So based on which it also regulates how much amount of dose that has to be given on an average to the entire room. Next, we have a core chip that is dedicated for safety, because as you know, you are using UV, you have to be safe. That's why we have collaborated with other company which actually makes these microcontrollers, so that can actually make a AI-based safety chip which actually regulates the amount of intensity that is given for the entire room.
Now, in an outset, we would like to treat every single Indian, but looking from a business strategic point of view, we would like to first target the workforces of the organization which have a large workforces. Let it be companies who are having, let it be companies who have workers who are working outdoors, or let it be companies who have software workers. So this, based on that, our scalability increases, and this is our TAM sum sum. And if you look at our milestones, it will take around 6 to 8 months to build a MVP, minimal valuable product, post that annual testing, ethical clinical trials. And with this, we would like to ask a demand of around 10 lakhs. So sharks, how many of you would like to be the part of the mission of making India from vitamin D deficient to vitamin D efficient?
How are you spending these 10 lakhs? Because here the number is not matching for me.
Yes, so this shows that you guys are paying attention. Thank you. So initially we would like to build a small prototype of our whole product. We have collaboration with other companies. It's a microchip
actually
company.
In Hyderabad we have a company called as Moss Chips, which actually makes in silico design of VLSI company, so it designs chips. So we have actually talked to them, and they said that we can actually make a custom designed microcontroller which can work with AI related stuff, because as you are using LAMP, which can have, AI can make mistakes, right? It's written in Gemini also, AI can make mistakes. So that's what we thought, that if we have an AI chip, a custom chip. No. So that's why in our lamp, one of the main important component is the safety, because UV lamps are very dangerous if not regulated. That's why we thought that, okay, if we have a custom chip, which is custom designed by the company itself, then it should be able to regulate the safety of the work. So that is the costliest part of the entire design.
Suppose that it will be for ethical trials.
Yeah,
and
as you know, clinical trials, you have to hire subjects, and subjects take money. Nobody will do for free. So
yeah, so that's pretty much it.
So what I gather is most important component is outsourced, right? The chip, which is the most, which is outsourced. So what stops other company doing it themselves?
Perfect. So the first thing will be the custom built chip which you are making. We would like to patent it. We have talked with the people. It's called Moss Chip. The company's name is Moss Chip Technology. So the design which we will make, we are going to patent it. So that stops us from copying other people. Apart from that, if the company grows big, let's see, like we can sell it off to Philips also.
I don't think things work that way, but good, nice to see your presentation.
Hi, great confidence in the pitch, both of you. Once, let's assume that the product is ready. How do you plan to reach out to the users? I mean, what marketing strategies do you have?
So first we would like to reach out to companies, like, so you can see here lights are there, right? So you need not have one single bulb. There can be one particular light source which can enlighten the whole room. And based on that, we can start with big companies. For example,
yeah, actually what we thought was, indoor people, especially IT companies, they don't have exposure to sunlight, and most of the entire day they spend in indoors, and they never have exposure to sunlight.
Correct.
So even if you have a bifunctional lamp, let's say it's both white LED as well as UV, then it can switch between them, and you need not actually rely on a separate UV lamp separately put in another room or something. Instead, you can just combine with all these lights, and that can actually be triggered by the company itself. Like for example, if you have sunbathing time, let's say for 5 minutes, then you can just run the lamp for 5 minutes or required time. That's been tested already. Just 1.5 minutes of exposure is enough to generate enough vitamin D. So like that, we can actually plan with the companies itself, so that their customers are benefited in them, so like their employees are benefited, as well as we are also benefited.
So basically, you want to go through the B2B route to companies individually and go and pitch them, and not the retail market per se.
So once safety is completely like certified, because this comes under biomedical devices. So if safety certificates are there, then we can actually go for public. But at present, companies are the main route, because there you can actually have more regulations than
we would
general
also
public.
like to start with beginning an awareness that people are not aware that they are vitamin D deficient. Like in this room itself, I can guarantee 80% of you will be vitamin deficient.
Even we both
are vitamin D deficient. So with that, this also comes under environment and sustainability development. So we would like to talk to government also.
So first of all, great idea, and actually it's a problem, a real problem. What I ask that you have mentioned about skin sensor and AI dosage and all. So that will be part of your bulb, or like how it will happen? How dosage will happen?
Part of the bulb only. So let's say if you take this as an example, it has sensors in the 4 corners of this, and it will scan towards whatever area that can capture. In that particular area, it will scan how many people are there, what kind of clothing do they have, and what amount of skin is actually exposed. Because people have different clothing, right, nowadays. So based on how much amount of skin that is exposed, the next IR sensor is turned on, which senses the depth of the skin. Let's say based on temperature, because temperature can actually tell you how much amount of skin thickness is there. So based on which it senses, okay, this is the average dose that can be required for this particular section. Since we are putting 4 or 5 bulbs, all of them work independently. For example, thick people sit there and thin people sit in the front, then it will actually calculate how much dose is required in this section versus that. So that's where these 2 sensors actually work in coordination to provide that kind of area. And mostly this safety chip actually tells, like, in case if it overdoses, then it cuts off to white light.
We are using AI, but we are not going to completely rely on AI.
Yeah.
Are you taking into account the skin tone? Because everybody will have a different absorption of the phototherapy.
This we are going to, like, we have not thought about it, but we are going to, when we are integrating our AI based chip, we will be thinking of it.
At what valuation you are raising 10 lakhs?
The first thing will be making the minimal viable product, which will be costing us around 2 to 5 lakhs. After
that, at what valuation you are raising 10 lakhs?
What valuation which you want? Shares of our? That's very sweet of you. Thank you. We would like to talk with AIC SEED and then negotiate. Come back to you. Thank you.
Actually, to answer that, we need a little bit more mentorship.
Yeah. Thank you, team already. Next team, Motozyme. Nikki and Akash, please. Yeah.
Hi, so we are Motozymes. We engineer motor-driven enzymes which cuts DNA, providing fundamental tools for next-generation sequencing, which has transformed how we treat cancer, manage TB, handle a pandemic, and protect prenatal preborn babies. It reduces the timeline for information from 13 years to 1 day. And a critical part of NGS is fragmenting DNA, which is basically cutting a billion base pair of genome into small DNA fragments and sequencing them. The entire market size of NGS is about $10 billion, out of which enzyme-based fragmentation forms around $500 million alone. The 2 leading enzyme-based fragmenters in the market are Tagmentase and Fragmentase, and they are also, they have their specific limitations. For example, fragmentase form non-uniform DNA fragments. They are both reported to have sequencing bias. An average bench time for fragmentase is at least 30 minutes. Both of them are imported, so they are extremely cost intensive. And for Tagmentase, you need high concentration because the enzyme itself is unstable. So we are providing a one-pot solution, which is Motozyme, which is a one-of-a-kind indigenously engineered enzyme that produces uniform DNA fragments in under 15 minutes with no sequencing bias, and is a highly cost-effective solution which is compatible with all current Illumina sequencing platforms and is also IPR protected. Not only that, it's a universal DNA fragmenter. That means it's tested against some of the difficult pathogenic genomes, providing more than 99% genome coverage, a very high quality information at just 2 million reads. And this is the cost distribution that we have projected for Motozyme, which is a whopping 30K for a 24 reaction, which is a 60% cost reduction. You get maximum information at half the price. So we are asking for a capital of 1 CR to upscale our product through extensive marketing and manufacturing, so that we can immediately connect with and distribute Motozyme to sequencing companies across India. And the timeline we have for a completely QC ready packaging product is about 1 year. This is the team, our mentor Professor Sai, myself Nikki, my teammate Akash, and the person whose fundamental research has led to this biotechnological tool. At last, I just want to say that we are beyond just making it in India, because we've already made the product in India. What we want to do is upscale and market in India. Thank you.
So just to confirm, the product is ready, that's what you're saying, right?
Yes.
Are you sure that the timeline that you are mentioning is realistic one? That's
Yes,
one
so-
question.
okay.
And as far as, does this product require clinical trials as well?
No. So with the infrastructure that we have right now, we can supply for sample testing for at least 5 companies or 5 labs across India. Therefore, the moment we have the manufacturing unit set up, either a biofermenter that we have to set up or use a facility, in 1 year we'll be ready with the product, because we have filed for an international patent. So we have all the data that is needed to have a validation for different kinds of genomes.
So you talked about your solution being cost effective.
Yes.
So how, in terms of cost, how does it compare with the existing solutions?
So we have this. So a typical tagmentase based kit for 24 reaction, it charges about 74K. That's how expensive this kit is. Once we make this motorzyme into part of a kit, which would have all the other components apart from it fragmenting the DNA, it's 30K for 24 reactions. So that's a 60%.
Margin, cost of distribution, everything?
Yes.
Yes. So this is actually at a basic small scale. So when we upscale, this definitely will come down.
Yes.
And for example, our total cost of raw material, or in terms of if we take charges for instrument of purification, it will cost us mostly around 40,000 for a complete 3-day process. But our total selling from that batch will be around 10 to 12 lakhs. So we haven't taken into account salary or what right now, but just for raw material, around 40,000.
One question, how are you planning to make this, like which expression system you are going to use to make this enzyme?
This is basic E. coli system in regular basis research lab, BSL1.
Okay, have you done some external validation of your enzyme? I mean, I'm sure IISER has an NGS facility. So for you to validate it.
So we have, so in terms of fragmentation, we have tested all kinds of genomic DNA, human, pathogenic genomes which have GC-rich pseudomonas, AT-rich genomes like Plasmodium. And for bacterial genomic DNA, we have the sequencing data. We have 99% coverage for bacterial DNA at just 2 million reads. And the mean depth for that is 40.8, which is a very high confidence for
So what you're saying is, on one hand you have used tagmentase, and on the other hand you have used your enzyme, and you have run the entire NGS pipeline to do this benchmarking.
We have not exactly used tagmentase, but we have used fragmentase to compare our fragmentation, our motorzyme.
Thank you.
One more great thing for our enzyme is that we can supply even in a dry form, which is more stable, room temperature stable, lyophilize.
No, so it's we can lyophilize it, we can transport it, the person can add milli-Q and then go ahead with the reaction.
Yeah, hi. One question. How big is this market?
So NGS itself is around 9.8 billion, so around 10 billion market. And considering enzyme-based fragmenters, it's a $500 million market.
Okay, and once you raise this money of 1 crore that you say, what is the kind of market that you plan to cover?
We are planning to cover, to begin with, all the sequencing companies in India, starting from some of the leading sequencing labs in India, Medgenome, Unigenome, and Eurofins, which like extensively do sequencing for like population level WGS sequencing.
What is the kind of billing that you can expect from them? Tentative?
So, I mean, right now we don't have such an idea, but this projected MRP, it may vary as per academics. We also are planning to go for academic sales, where researchers require NGS and this preliminary step. So, based on the scaling of our selling, we can just lower the cost and increase our market.
Okay. Okay.
So whatever testing you have done, that is done in the lab scale, or you have collaborated with any customer and they also checked your product?
So the entire testing has been validated by us. So we have done all the experimentation, validatory experimentation as well as sequencing data. For sequencing we have outsourced, but fragmentation and quality control, everything has been done by us.
And till now, have you contacted any customer and approached them
No, which is why we want to pitch, because we want to now market the product. We want to make connections. We want to popularize this motorzyme so that we can have connections and immediately distribute. Which is why I said that at current position with the current infrastructure, we can distribute to 5 companies, 5 labs at least.
Okay. So once we are finalized with our patent, we would like to test these products with
yes.
labs in IISER.
Yeah.
Which do NGS sequencing.
Okay, thank you.
And how old are your team is like? You guys are working together since when as a team?
So Vishal is the person. So this tool is a result of his fundamental research, which is like 6 to 7 years of his PhD. That we are now creating
And as a team, you guys are associated with them for that long years.
No, as a team, we 3 are there, our professor, myself and Akash.
Okay.
Yeah.
Okay, 3 years. Thank you.
Thank you.
Thank you.
At this point, we would like to take a small pause. I'm very happy to say that Professor Bhagwat is here with us. From his hectic schedule, he rushed from another appointment, and thank you, sir, for coming here. And I would request you to please share a few remarks.
Hello, good evening. It's always difficult when what you do in the lab is getting converted to a business or a commercial aspect. I also understand that the difficulty arises from the fact that most of our science graduates rarely look at a subject called economics, and when questions are asked like what is the current market potential or what will be the total billing that you are likely to get, these are questions which most of you are probably not ready with. But if you are going to pitch for a business, you need to understand those terms, and we need to show that being able to do business is not restricted to those who learn technology, and its science students also have a very strong potential of having science-oriented businesses. So wish you all the best, and you have a grand jury to tell what you need to do more. So best wishes. So from practical experience, they are going to tell you things.
Thank you, sir.
Up next, we have Synaptogen, Anshuman and Durgesh.
So, hello everyone. Have you ever wondered that how traumatic and tragic the hearing loss and neurodegeneration can be? Well, let me tell you that there are almost 1.5 billion people on this planet who are suffering with the problem of hearing loss and neurodegeneration. Well, what does the temporary situation is? The temporary therapeutics tell them to use a cochlear implants. Well, it is just like using these Stone Age things into the modern Avengers era. So, what's the solution? The solution is Synaptogen, presenting you an AI-powered mRNA therapeutics platform where we can do the pre-symptomatic diagnostics of microRNAs using a supervised learning, followed by the synthesis of a synthetic mRNA that can be incorporated into the cell using the nanoparticles. These synthetic mRNA can then indulge and lead to the formation of epigenetic modifiers and transcription factors, which can lead to the transformation of dormant cell into the fully function as well as the stimuli responsive cell. Well, you may have a question that why am I speaking about it? Then ladies and gentlemen, let me drive your attention towards this fact that in 2026, the patent on mRNA synthesis and therapeutics is going to expire, and the whole jury of all therapeutics industry is going to beep into this. Well, this exponential curve of increase in mRNA therapeutics tells us that this is an actual hotspot for therapeutics and pharmaceutical industries.
So, doing market analysis through a typical TAM SAM SOM framework, we figured out the numbers which are in front of you to see. So how do you plan to make money? Because that's the most important question. This is the plan. So first we will venture into diagnostics, because diagnostics is comparatively easier to enter. So basically pre-symptomatic detection of basically neurodegeneration and hearing loss. Then we focused on AI licensing and basically licensing of the IP we create. And finally therapeutics. And this is our execution roadmap. Thank you.
I hope we ended in time.
I have a basic question. You just said that the patent cliff is going to expire and you're a startup. Do you understand there is Sun Pharma waiting with several $1 billion to launch this next day? How are you planning to beat them?
Well, it's all about connecting the dots. If you are connecting the dots, you can make a circle and a line as well. So if someone is going along to make a particular way, the target particular is different as compared to other pharmaceutical industries. And well, we had a look at some data as well. So there are some keynotes about our ideas, which are somewhat not there in them. So it can be beneficial for us to move ahead with this. I hope.
So what's not with them?
What's not with them is actually this model of AI diagnostics. If we see that there has been an increase into the use of artificial learning and artificial intelligence and machine learning in simply screening out those genes and to do the NLP platforms and studies. And well, Anshuman can also add on to it.
So basically, my basic answer to this is basically everything like can be done by anyone. So like the word is too competitive. So like if we think about that, then nobody should do any startup, right? Because there are big companies in every sector. But to figure out, like most of these big companies, they are not agile as like these startups. So they don't see some niches that we can see. For example, we are not talking about big neurodegenerative diseases. We are just focusing on hearing loss. So they have different plans. So that's my answer.
So in terms of pricing, how do you plan to price it, and give us more idea about what are the existing solutions that are there in terms of price points?
So the basic solution is basically cochlear implants, but it's not the very good solution because it's not permanent and you have to wear it every time, so it's not very good. So talking about, there are a lot of gene therapies which are coming up, but that's not exactly safe. So here exactly, like we have control over like the termination basically.
Price point.
Price point. So initially we are looking for only diagnostics and therapies. So the correct price point we have not arrived at, and that will be arrived in due time.
Well, by giving the background, I'm a major in chemistry and he's performing is in machine learning and artificial intelligence. So we are working on the ideas and to construct it with AIC SEED and hopefully with future partners.
Okay. What is your plan for the next 6 months?
So the most important part is basically the profiling of microRNA, so that we can build a diagnostic pipeline, and that's the most important thing we will focus on. And then surely gradually we will move towards basically therapeutics, in which we will use LNP to basically integrate the microRNA.
Your 6 months pattern. Okay. Please go to the previous slide. I mean, just do some spell checks. Solution AI diagnostics. A is missing out there. Just a small error. Solution, you have AI diagnostics engine, right?
Apologies for that.
Just a small observation, so thought to share.
Thank you. Thank you.
Do make a check, a proofreading prior to that. But nice presentation.
So I have a question from a normal person viewpoint. If I use that implant, immediately I can hear properly. Now if I'll go for this therapy, diagnostic and therapy, how much time it will take to restore the hearing loss?
So firstly, like if you use the device, so you have to wear it every time, right? But this is a permanent solution. So we are thinking of 2 to 3 months therapy is more than sufficient. What we are arrived at the numbers. So this is our answer.
And will the timeline will based on the hearing loss, like how much would be the hearing loss? Based on that, your therapy time will
So
also.
the therapy time will depend upon like the extent of neurodegeneration that has happened. So for example, the diagnostic pipeline we've talked about, the reason is same about that, because when we diagnose is late, almost 70% neurodegeneration has already happened. So reversing it become more difficult. If we catch it in the earlier period only, then the timelines will be even shorter and the solution is even cost effective.
Thank you. Thank you so much, guys.
Thank you, sir.
Next team, Rajin.
Just imagine this. There is person A, person B, both with similar symptoms. They go to a clinic, they are prescribed the same thing. But person A gets cured while person B is stuck with adverse side effects. This is because the genetic composition of person A and person B is not same. We at Drujin wish to eradicate this problem. We wish to integrate the genetic data into the healthcare system and provide personalized treatment. So here's how it will work. You sign on our platform and get your genetic sequencing done. We then give you your future health risk assessment and your Drujin ID, which will be unique. And you will also get a AI assistant chatbot whom you can chat and get your health advice and how to prevent your future risks. Now, after when you do need to go to a doctor, in the app you can check locations where Drujin is active. The practitioner will have access to our database, and using that database, when he puts your ID in, he will be able to access your data and look at which drugs are more effective on you and which drugs can give you side effect. Then he will give you personalized treatment. Obviously, our customers will include patients suffering from serious illness. It will be very beneficial for them to have personalized care. It will include doctors and clinics and hospitals, because if they cure the patient faster, their reputation will increase. It will also include health enthusiasts and fitness influencers, because they who want personal care in their health. Now, the timing could not be more better, because the genomics market is increasing very rapidly, and the cost of sequencing is reducing year by year. Currently, it is about $1,000, but by the next years, it is supposed to go down to $100. And with the rise of AI, data, seeing the genomic data and analyzing it is also getting easier. We at Drujin strongly believe that the future is not one treatment for all. It is the right treatment for the right person at the right time. Thank you for listening. This is Drujin.
Can you give me one example where your Drujin tool could actually work? Like, give me an example of a disease.
You want to say that?
Like in HIV treatment, there is a drug named, I forgot the name, but there is a drug which like acts on some people, like it shows severe adverse effects on some people, like in some cases they die also. Like for that thing, the practitioner like first do the genetic tests. So if we already have the patient's genetic data, so we can do that faster.
I just want to know two things. One is, what's the legal framework for this in India?
Yes.
And second, what other ideas you guys explored before?
So genetic sequencing is not unique. MedGenome, MapMeGenome and many other companies do this in India, and they do charge that for us. So we will partner with them to do the genetic sequencing, because we don't have the infrastructure. About the legal issues, the data will need to be protected, and it is actually a big issue, because sometimes they sell the data to health insurers so that they can access their clients' health information. Currently, there is no legal framework as such about the genetic data, but it as it increases the demand, it will be built.
So my question was on the same lines only. How do you, like, since this is patient driven, so data is key. So how do you plan to safeguard the data? Do you have any thoughts?
The data can only be accessed if you have the ID of the patient. Unless the ID number is given, the database won't show the data of the patient. That's how we hope to do the legal work, but we are still figuring that out.
Nice thought process, but requires more work on this. But yeah, great attempt.
So have you checked with doctors whether they will check that data before giving any medicines and all?
Actually, he's the bio guy, so I thought he will answer it. But see, genetic data is very useful in medical purposes. Like when they know which drug is more effective on the person, it will cure their patients faster. So obviously, they want to see the genetic data of the patient before prescribing anything. The problem is they don't have the data, and we are helping them create a system by which they can easily access this data.
But don't you think that it will increase the work of the doctor itself? Because each person, he has to check the genetic data and then give the prescription. So how, like, or you have any solution where once that ID is entered, that person, what would be the major, problems? It comes in front of the doctor and then he can suggest.
Ma'am, when we go to the hospital, they give us a medical record where every time we go to the hospital, they store our record. Then next time I go in, they check my past medical record. It is just like that. Just like they check my past medical record. Now they can directly check my genetic data and prescribe me something. They already check our past medical record to know us better. Knowing our genetic data will give them 100% surety that they know us better.
And if you go to different hospital, then they don't have, then how different hospital will get access of?
So that's why in the app we will provide them a search option to see locations where Drugin is actively being used, so that they can go to that place and use the app.
Okay, thank you.
So you will onboard doctor first or patient first? Honestly, it should be doctor first, because if we onboard doctor first and they prescribe to the patient ki you should go get your genetic sequencing done and get your ID created so that I can treat you better, it will be better. So we hope to integrate into hospital chains and doctors first, but realistically I think it will be first used by as a luxury by rich people, because currently the price is way too high to be used by common people. In the long term, we do wish to integrate this into centralized health systems like the ABHA ID by central government. That's, yeah. Thank you.
Pricing, have you thought for this?
Pricing currently is around, first, pricing will be around $1,000 for the genetic sequencing, plus some commission for us, because most of the money will be taken by the genetic sequencing companies, because we don't have the infrastructure. Then later we also wish to charge the doctors and hospitals, because they are using our database to treat the patients. So we are earning from two ways, from both the patients and the doctors. And at later, if we still need funds, we can sell it to the, it is legally bad, but we can sell it to the health insurance companies to earn from them too.
Just one last question I have. How big is the human genome?
Very big, like 3 million. 3 million base pairs, but like around 6,000 genes are the ones that get affected by drugs, and around I guess 20% of that has already been researched on. Some of the drug gene relationships is not available, and it is still getting researched on. The data is there, but not the entire data.
Good evening. Let's start the today's session by the basic of kinematics. Acceleration is the rate of change in velocity.
सर थोड़ा हिंदी में समझा दो ना प्लीज़.
त्वरण वेग की में परिवर्तन होता है.
सर हिंदी बोला था, संस्कृत नहीं.
अच्छा, सिंपल भाषा में. तो एक्सेलरेशन मीन्स वेलोसिटी में कितना जल्दी चेंज हो रहा है.
तो जजेस जो भी आपने देखा, ये जस्ट एक एक्ट नहीं, इंडिया के लगभग 60 to 70% कॉलेज स्टूडेंट का एक्चुअल प्रॉब्लम है, जो टियर 2 और टियर 3 सिटीज़ से आते हैं. जब वो स्कूल में होते हैं तब जो उनका स्टडी होता है वो मेनली हिंदी या उनके रीजनल लैंग्वेज प्लस इंग्लिश में होता है, और जब वो कॉलेजेस में आते हैं तब वो कंप्लीट इंग्लिश में शिफ्ट उनको करना पड़ता है, जिसके वजह से बहुत सारी चीज़ें उनको समझ में नहीं आती. उसके वजह से फ्रस्ट्रेशन होता है, पढ़ाई नहीं हो पाती, और फिर लोगों को लगता है कि गाँव के लोग जो आते हैं उनके पास दिमाग नहीं होता, जबकि ऐसा नहीं है. मेन प्रॉब्लम होती है लैंग्वेज बैरियर की.
इसी बैरियर को तोड़ने के लिए हमने बनाया है विज्ञान सेतु.
तो विज्ञान सेतु एक ऐसा प्लेटफॉर्म है जो क्लासरूम के इंग्लिश लेक्चर को रियल टाइम में स्टूडेंट को उनके रीजनल लैंग्वेज प्लस इंग्लिश में ट्रांसलेट करेगा, जैसे तरुण ने अभी मतलब करके बताया है. और इसी विज़न के साथ हम लोग
ग्रांट करते 25 लाख का अमाउंट।
इसी विज़न के साथ हम लोग आस्क कर रहे हैं ग्रांट ऑफ 25 lakhs।
आप AI मॉडल यूज़ कर रहे हैं, सही है?
ये सर
मार्केट में अभी बहुत सारे AI आए हुए हैं हिंदी लैंग्वेज के लिए, कोई नाम बताएंगे?
सर अभी सर्वन का सबसे ज़्यादा नाम चल रहा है। एक्चुअली सर ये सब जो हैं ये बहुत जेनरिक मतलब कर रहे हैं। जो हमारा है वो स्पेसिफिक साइंस एजुकेशन के लिए है। और जैसे ये हमारा पूरा प्रोडक्ट होगा जो क्लासरूम में ही टीचर क्लास जैसे क्लास स्टार्ट करेगा, जैसे जूम पे स्टार्ट होती है, वो अपना मतलब लेक्चर देगा और स्टूडेंट को रियल टाइम में उनका मतलब वो चला जाएगा। लेकिन
आप फाइन ट्यून करने की कोशिश कर रहे हैं फॉर साइंटिफिक डेटा,
यस सर,
एजुकेशनल डेटा, लेकिन इसकी ज़रूरत है
एक्चुअली। यस सर, क्योंकि जब हम इंग्लिश से लेट्स से हिंदी में जाते हैं तो ऐसी बहुत सारी टर्मिनोलॉजी जो
मतलब आप बता रहे हैं कि सर्वम का जो AI है वो इसके लिए काम नहीं कर रहा है।
एक्चुअली सर मैंने सर्वम पे उतना रिसर्च किया नहीं है कि मैं पूरा आपको बता पाऊँ कि कर रहा है या नहीं कर रहा है, बट हमारा स्पेसिफिक इसी के लिए है। एंड ये हमारा पूरा एक पाइपलाइन, पूरा एक कंप्लीट प्रोडक्ट होगा कि लेट्स से टीचर अपना क्लासरूम चालू करे और स्टूडेंट उस क्लासरूम में ज्वाइन हो, उनको डायरेक्ट उनके ईयरफोन या हेडफोन में डायरेक्ट रियल टाइम में उनका लेक्चर आता रहे।
ये बेचोगे किसको?
सर हमारा मतलब 2 आइडिया है। हम डायरेक्ट इंस्टीट्यूट को अप्रोच करेंगे, अगर इंस्टीट्यूट नहीं माना तो वी आर मीन्स काइंड ऑफ सब्सक्रिप्शन बेस रखना चाह रहे हैं विथ वेरी नॉमिनल चार्ज ऑफ लेट्स से 49 रुपीज़ पर मंथ पर स्टूडेंट।
सो कंटेंट तुम्हारा नहीं है, कंटेंट का ट्रांसलेशन सिर्फ तुम्हारा है।
यस सर।
उसके लिए कोई क्यों पैसा देगा?
सर ग्रामरली के लोग पैसा देते हैं
सिर्फ ट्रांसलेशन के लिए।
नो सर, ये एक टूल है। और जैसे मुझे प्रॉब्लम हो रही है सर, वी हैव डन अ सर्वे ओवर 55 स्टूडेंट एंड मोस्ट ऑफ एक्चुअली विलिंग टू पे।
कहाँ के स्टूडेंट्स थे?
सर वो IISER के स्टूडेंट हैं एंड वी हैव सम फ्रेंड्स ओवर डिफरेंट IISER IITs।
जो लोगों के लिए तुम बनाने का बात कर रहे हो उनका तो सर्वे में रिप्रेजेंटेशन बहुत कम है, फिर तो सर्वे वैलिड है वो?
अभी सर सर्वे में कितना % लोग पे करने के लिए रेडी हैं, हम उस पर थोड़ा मतलब फोकस कर रहे हैं। आई नो सैम्पल साइज हमारा थोड़ा छोटा है।
कहीं चला के देखा है आपने इसको? मतलब
सर अभी हम मतलब बनाने के ही फेज़ में हैं, जो अभी मतलब चला के नहीं देखा, बनाने के ही फेज़ में है।
और 25 लाख रुपए आपका जो ग्रांट है उसे किस चीज़ में यूज़ करोगे आप?
सर अभी आपको तो पता है लार्ज लैंग्वेज मॉडल को ट्रेन करने में बहुत ज़्यादा कंपटीशन पावर लगती है, तो हमारा मोस्ट ऑफ पैसा उधर जाएगा, प्लस कंपनी के सेटअप में मतलब हम लोग यूज़ करेंगे। कॉइन का मॉडल है उसको।
सो आपने अभी इसका कुछ बेसिक मॉडल बना के चेक किया है, मतलब आपके ही ऊपर कुछ बना के और देखा है क्या?
सॉरी मैम, आई डिडंट गेट।
मतलब आप जो ये बोल रहे हो, सो मे बी मार्केट या यूज़र वैलिडेशन के पहले आपने ही कुछ छोटा प्रोटोटाइप बना के लेट्स से 1-2 मिनट का, जिसमें आप इंग्लिश में बोल रहे हो एंड देन आपका जो भी AI है या प्रोडक्ट है वो उसका जो भी लैंग्वेज है उसमें ट्रांसलेट कर रहा है, आपने
एक्चुअली मैम जो ये मेरा मॉडल है अभी करंटली बिल्डिंग फेज़ में ही है। अभी हम डाटा जनरेशन के फेज़ में हैं। डाटा जनरेशन के बाद उसका ट्रेनिंग, फिर मतलब हम उसका वो करेंगे। हाँ, डाटा मीन्स अभी सर सॉरी, एक्चुअली ये प्रोजेक्ट हमारे मतलब एक प्रोफेसर हैं विदार्थ गोस्वामी, उनके सुपरविजन में हो रहा है, तो आई डोंट हैव दैट आइडिया जो आप पूछ रहे हैं।
डेटा साइज क्या होगा? डेटा साइज क्या होगा?
ऑफ व्हाट?
जो डेटा आप यूज करेंगे फाइन ट्यून ट्रेन करने के लिए, उसका साइज क्या होगा?
वी आर मीन्स हमने सोचा है 5 लाख पेयर्स ऑफ इंग्लिश एंड हिंदी। 5 लाख पेयर्स ऑफ इंग्लिश एंड हिंदी, इंग्लिश एंड हिंदी।
कंप्यूटर की भाषा में कितना होगा डेटा?
सॉरी सर, कैलकुलेट करना पड़ेगा। Thank you, sir.
Good evening, everybody. This is Team Leader Sync. My name is Balram. We're both first years, by the way. So my name is Balram,
and my name is Deepmalia. So, growing up in West Bengal, one of the biggest problems that had plagued me ever since my formative years were the polluted oceans and the degraded coastal ecosystem. And later on, learning about the degrading wild catches of the local fishermen, we have come to realize that a lot of these problems stem from unsustainable fishing methods such as trawling, where you can see in the schematic where a net is dragged through the ocean floor, completely destroying the benthic ecosystem, leaving the ocean floor devoid of life.
So what are we going to do about this? We have come up with a new system of farming, and what we are farming is essentially seaweed, which, if you have been following the news, is a booming industry right now in India. So we'll be farming seaweed on these horizontal grids arranged on shallow ocean waters. But to these grids, we'll also be attaching tanks of shellfish and mollusks. But why are we doing this? Well, by introducing these seaweed, shellfish, and mollusk species into waters in which they once thrived, it has been experimentally shown that it can transform and regenerate the native ecosystem completely. And the beautiful part is the farmer is incentivized to, well, the once fisherman is incentivized to take up this sort of livelihood because it's much more sustainable and stable than the dwindling catches that they're getting from these unsustainable fishing methods. So,
putting some numbers to our idea, we have seen to create like one prototype, which is a 10 by 10 grid of these farms. We have estimated about a setup cost of 37 to 55,000, and assuming a farmer has like 1 hectare of farm, which is assuming 100 units of these prototypes, they are expected to get a profit of 6 to 10 lakhs. Oh, there's a little typo, it's 10 lakh. Of a profit margin, and we are planning to either sell or lease these farms to the farmers.
So we are, the first phase of our plan is to make a working prototype, and we expect to get this done by the end of July by collaborating with institutes who are focused on this sort of farming.
Yeah, thank you.
So if I understand correctly, you would be selling the structure, right?
Exactly. We'll be making these units,
yes,
which like we estimate to be between 37 to 55,000. And yeah, we'll be leasing or selling this. We aren't exactly sure at this point.
So I'm certain that such units are already there in the market. So what differentiates you, and how do you perform in terms of cost parity with the existing players in the market?
Exactly. So as far as we know, you're right. Recently, India has started looking into these, especially along like Chennai and Tamil Nadu coastline and Gujarat coastline. But the idea that they're missing is essentially this: the tanks which are of shellfish and mollusks. This, as I said, not only regenerates, like you can see this drastic change. Not only regenerates it, but it's extra income, which like these go for very high in the local markets. We won't exactly have a problem selling these. So we, as far as we know, we haven't seen this coupling going anywhere. Outside India. So outside India it's happening, not here.
It's a matter of time that they come to India. If market is ripe enough, it's very easy for companies to come to India and implement it.
Yeah, that's why we are jumping first.
And how do you plan to differentiate yourself from competition?
Right, exactly. As I said, there's nobody right now. So there is seaweed farming happening, but there's no coupling with these seafood thing. So we currently don't have any sort of competition. For future competition, we're just going in hard, and we're trying to get it done as soon as possible.
Okay.
How big is this market?
Sorry?
How big is this market, and how much you want to capture in next 3 years?
Balram, if I can take this one. So the market isn't like one fixed market. We are selling these units to the farmers, and if they are buying it, that's one thing. But the market of like the product we are selling seaweed and the mollusk. Like as we know, mollusk farm, it's a very expensive, like a premium delicacy. And seaweed, which is like our main thing, it has multiple uses from our research. It is used in the pharmaceutical industry, the biomass industry.
Yes, so it would. We'll be honest, we haven't come up with the numbers, but seaweed goes for a lot of things. Biomass, it's used in agar. Agar is made up of seaweed. Then it also used as a food. Like, it's not too popular in India right now, we'll be honest, because of socio-cultural reasons. But in Korea and Japan, it goes... Yes, Southeast Asia, it goes very high.
So there are already many startups and big ones who are working in the field of seaweed.
Exactly.
No, why don't you collaborate with them and sell these containers to them? Because your USP is containers, it's not seaweed. And in seaweed also there are multiple types of seaweeds. It's not single type. And maybe if your expertise is in these containers, why don't you collaborate with them? Because anyways, the moment you will launch this in market, they already have a big seaweed farms. So they can copy it and they can also do it.
Honestly, that we could also do that. So once we get the prototype exactly, we'll try to like intellectually protect it, and we will definitely look into the exact business model. Our entire efforts went into exactly brainstorming how exactly we're gonna make this work.
Okay.
In 2025, many of the top hedge funds in the world have performed terribly, including Citadel, Renaissance, many of them. Except there has been a hedge fund in Europe called Vertus, who have severely overperformed with 50% returns. What is the difference about them? They are an AI native hedge fund. This concept has been told to be the next Renaissance movement, where Renaissance, as you know, has been the pioneer of quantitative finance in 1989 and has been the best performing fund for the last 30 years, not anymore. This idea has been severely undertapped in the Indian market until now. Introducing Stratos. Hi, I'm Sriram, a junior data science student here at IISER, and I've been building various multi-agentic systems for the last 1 year.
I'm Vivek T. I'm a math and machine learning student at IISER Pune.
We at Stratos are solving one really important problem, and that is to find correlation between structured data, which is the market data, the numbers, and unstructured data, which constitutes F&O options, reports, SEBI reports, and even including Twitter news and various other news sources about the stocks. This is a problem statement heavily validated by people that we have personally talked to, many of the quants and institutions like Nippon, Polytechnique, Paris, and Alpha Alternatives, and the best startup accelerator in the world, Y Combinator themselves, which we have applied for, by the way. How it works, over to Vivek.
Yeah. So our system essentially goes through levels, taking up all the data that he mentioned, including structured and unstructured data, that is passed through and compiled with to form strategies that may be evolved, or even using existing strategies to tweak the parameters and make new ones. These evolved strategies are then gone for human approval, which is then validated upon, and then finally got into deploying stage. These are of course also battle tested through Monte Carlo simulations and all the simulations that can be done for the market. And finally, this is our proof of work. This is the simulation run from 2018 to till now. And the blue line indicates essentially our model's trading behavior, while these two green and yellow being the Nifty indices, 550. The total admissible market that is present right now in India is over $35 billion in 2026. And this is largely untapped for, in fact. We essentially cater to HNIs, family offices, and institutional traders that may be present, including ultra HNIs as well.
We are looking for 4 to 5 pilot signups with an aggregate amount of 30 lakhs, where we'll be trading for the next 6 months to get data for us to actually register as an AIF3 hedge fund. Thank you.
Thank you.
Sorry, the graph is not very big. How many years past data you have used?
From 2018 to 26. The training was done from 2010 though. So 2010 to 2017 is the training data, and this is the test over 18 to 26.
This is basically Nifty 50 data.
Nifty 500.
Nifty 500.
We just compared it to the benchmark.
Okay. I have one question about your multi-agent. What is the framework that you are using?
So right now, in fact, the model that we are using, we have not included the news reports yet. This is purely on our reinforcement learning based engine that we have developed, and that is purely on the the structured data and a little bit of unstructured data here.
I'll
but
clarify
not
that point a bit. So this is one of the models that was developed by the system. This was purely based on reinforcement learning algorithms.
Okay.
Yeah.
So you said mostly it's a structured data. Is it fundamental data or is it technical data?
Both.
Yeah. Thank you.
So what you are trying to develop, how it is different from what Jane Street is doing?
So particularly this is a question that we had asked to these quants that we had talked to, specifically in Alpha Alternatives and Nippon, also including one intern that we talked to in US as well. So the particular points that they put was most of these firms out there are still relying upon the classical strategies like using basic machine learning algorithms, mainly because of the fact that a lot of things can go wrong. And these have not been projected upon by these firms, mainly because of the fact that they don't want to step into a new territory. There are, of course, I'm not saying that there are no research groups in these. There are research groups particularly looking forward to ways that can be applied, but more or less are ideas like, okay, what if we use something like ChatGPT, or what if we use something like Gemini? Problem with these are, you are giving out information to these companies, and they will have a hold of whatever data you're putting forward. And these institutions like Jane Street and all, as you mentioned, have particular data sources that are secretive to them. And that is their leverage over all other firms.
Just one question. I mean, in these early years, 2018 to 20,
yeah.
Your agent is not actually, I mean, it's performing pretty much similar to benchmark indices, but something happened after 2021, 2022, that it started performing better. I mean, any reasons?
Yes.
So,
okay. So your model is biased towards bullish markets.
So I'll answer that. So even though this might seem like a stable market, in 2018, in fact, even though the benchmark did not move a bit, all the funds out there actually performed very bad, mainly because of, I think, market corrections that happened in 2018. 2020 is the period, of course, as all we know, financial crisis happened due to COVID. And that year, in fact, our model did very stably. That was, in fact, the turning point, because of this stable leverage, our model actually shifted up. Doing actually more or less same as during the benchmark, let's say when the market is stable, is actually a good thing for a fund, because most of the hedge funds out there actually try to replicate the buy and hold behavior, that is the index, in a stable region.
So in a sideways market, your agent is actually not significant. I mean, it's pretty much similar to other tools. In bearish market, your agent is basically significantly like performing better, bullish which leads to basically like more returns during bullish phase.
Yes, but it's not doing bad in bearish thing. It's actually more or less stable during bearish regions.
It's robust to those phases.
And this is mainly because
that could mean that your model is probably trained more towards fundamental parameter, because this is what I see here. Because see, if the model is more biased towards technical parameters, it should overperform also during sideways market.
Sure. So according to the analysis of this particular model, this is only one of the models that were given as outputs. This was mainly done using, I think, FNO data and the quarterly reports. That's it. And that including some OHLCV data as well. So this is not the final model that we have got. We have also gotten multiple models and different markets, but this was the best one that we wanted to project here.
I think it would be interesting to see what other startups agents like that have been built and benchmark not against standard Nifty 50, but with other AI agents that are there in the market. I think I would like to see that graph more than Nifty 50 or Nifty 500.
Yeah. So this is this for one is universe agnostic. So you can change the universe and accordingly it can trade on that. So we can make our own index and do a comparison test based on that.
Very good.
Yeah. Thank you.
Hi everyone. Imagine you are one of the 1 billion pet owners around the world. You think your best friend is fine until they are not. A survey by the British Veterinary Association found out that 1 in 5 pets miss out on life-saving treatment just because we couldn't see the signs in time. By the time symptoms are visible to the human eye, the diseases are often advanced, making the treatment more expensive and less effective. We are Team Enome, and we are today here to give them a voice. We have developed Enome VetBand, a completely non-invasive wearable device for your pets that would be collecting the vital physiological parameters from your pet and send them directly to the Enome app. in which our machine learning models would be analyzing the patterns in order to not only detect but also predict the presence of any illness or health abnormality in them. By analyzing the data, we can predict weeks before a human eye ever could the presence of any health abnormality, and hence giving your silent companions a voice.
We surveyed 68 veterinarians and pet owners, and their response along with the market directly show the gap, as you can see in the TAMSAM-SOM data. There are 31 million pet dogs in India, 3.6 million pet cats in India, and literally every second household of Europe has a pet. But every one of them are relying just on visible symptoms. So Enome is what comes next. What's our scale-up plan? So first, we'll sell our vet bands to veterinary clinics and pet owners, through which we'll not just generate revenue, but also we'll collect the physiological data which will be used to train our ML models. Once the ML models reach a clinical grade sensitivity, we can license them to huge companies. And also we can partner with animal pharmaceutical companies. Our ask is 12 lakh, which we'll be using to develop a sustainable amount of minimal viable products. And we are a strong team of research students. And there is a market. This market has no established brand till now and no competitor. So you can trust us. Thank you.
So what is your go-to-market strategy? How you are going to launch this product in the market?
Ma'am, we have the go-to-market strategy is to make a device which is not initially a machine learning enabled what we plan to develop in the next 2 or 3 years. Rather, in the first 6 months to 1 year, we want to develop a normal tracker device which would be giving the vital parameters directly into the app. So initially, we want to create a brand awareness among the customers that such a thing exists, and the brand awareness will also help us to enter the market and get the validation first. So yeah, initially we can actually create it for 2,000 to 2,500 rupees. We have a prototype which we have developed for 1,500 rupees. So yeah, that's what we want to do in the first initial year as a tracker device.
And whether you have checked with the doctors what kind of parameters they want in this in this device, and which will help them to diagnose it better.
Yeah, our work is backed by recent researchers published in some prominent journals like Nature and Frontiers of Veterinary Science. The previous line.
No, I'm asking whether you have checked with normal doctors who are there in the who have the clinics, customers.
Yeah, the vets we did. 40% of them were vets and 60% of them were pet owners. So we asked the vets and they are really interested in the product. Now, whether this will work or not, that's backed by the research that
I'm
we have.
asking whether they have given you any parameters which they want in your device, which will help them to do better.
Yeah. They have suggested us for heart rate and temperature. They have given much focus on heart rate and temperature. They have also suggested us that we check for gastrointestinal problems as well as respiration as well. But using the research papers, we came to the conclusion that the 4 parameters that we are tracking, these are the bare minimum we will need to track the diseases that are common in India right now. So yeah, from their side, the 2 parameters, heart rate and temperature. These are the major focus they told us to do. Yeah.
The data that you collect, the product is at what, the thing that you said is prototype, at what accuracy is it working right now? Is it collecting all the things that you are feeding it, or how do you, the prototype is at what readiness stage? I mean,
right now the circuit is completed. We have not yet 3D printed to make a minimum viable product yet. The prototype is in a working state, and we have checked for it. It has reached clinical accuracy, that is 95% for each and every sensor. So we are limited by the accuracy of the sensors rather than our actual circuit. So the circuit is working fine, and we have reached that much accuracy. Now, whether this product will be helpful in the machine learning model stuff, so initially the minimum viable products that we want to send out for a particular, for 1 year, 6 months to 1 year, we also want to simultaneously collect the data so that we can feed it to our machine learning models and train it over there.
And the price per piece you said is approximately 1500.
For us to develop. For the last customer, it will be 2000 to 2500 for the tracker device. But we saw a pattern in the survey form for the pet owners that those who chose the major feature of our device as disease prediction rather than disease detection, they chose for a higher price range that they are willing to pay for up to 5,000 to 6,000 rupees. So yeah.
So here data is key. So because so you are going to monetize it on the data that you are going to share ahead, right?
Yeah.
The hardware is being developed in-house or?
In-house. We have people doing it. So yeah, you are a larger team. We are just 2 here.
Okay. What's your team size like?
We have 7 people currently working.
And the 12 lakhs that is going to come, you're going to use it in a span of what time?
6 months to 1 year.
Okay. Okay.
Thank you.
Yeah. So whenever faced, so we are Marcubis, a micro consulting platform. So whenever faced with a particular problem, people generally search through the internet only to end up with tons of generic advice. And in rare situation, they might find advice specific to their needs, but it often lacks authenticity. And this whole process is time and resource consuming. Our solution, a platform where you can connect with experts through one-on-one virtual meetings to solve your specific problem. To scale efficiently, we are narrowing down to an active users called digital wellness user. These are 85 to 100 million. Our customer segment is 15 to 20% of these called maximalist optimizers. So these are digitally savvy consumers who have spent lots of money on the product and they are still unsatisfied. They conduct extensive research to find what works best for them. So for a session cost at $100 and 5 sessions per year, it addressable market generates to be $7.5 billion. Our business model is we will charge 15% on top of the expert price. And if we can retain 21% of these maximalist optimizers, we will have a revenue about $240 million. Our go-to-market strategy is partnering with the credential expert, not lifestyle influencers, invite-only beta, and something called bring your own data initiative. You bring your data, hop into a virtual meetings with the expert, he will interpret it for you. And we will partner with the high-end gyms and the studios, featuring as a on-demand expert platform. We are affordable as well as technologically better than our competitors. And the ask is $400,000, and of which 75% will go into the product development with 25% on the hiring. Thanks.
So your competitor already has a product in the market, right?
So the competitor, I'll tell you, Minect and Intro, these are influencer centric. They hire only if you have a very good profile, they'll hire you for as an expert and they will charge $5,000 per an hour or maybe $400 per an hour.
So essentially you are low cost alternative to existing platform.
But we are not influencer centric, we are science backed because our customer wants a science based solutions.
So how do you differentiate yourself from science based platform that offers similar solutions?
So nobody offers that.
But I don't have a science-based problem. I want to fix my tile in my bathroom.
So, so initially, it's Marcubis is like we want it to be a big platform like all experts. But initially, we have to narrow down to a particular segment. We can't tackle everything at once. So we target these digital users. So they already have deep pockets. So they consume 40% of the market spend. 40% of market spend comes from their own pocket, and they have already tried influencers. They have tried different products, and they are not limited by the money or they want to experiment with the things to find what actually works best for them. So this is a micro consulting. Micro consulting means like you don't commit long term. So nobody in the micro consulting does that. It's like you have a problem. I hop into a video call with you. I specify my problem. We are done. So we don't have a long term commitment.
Is this scalable?
Yeah. So like it's already scalable. So these people, Intro and Minect. So the founders. So their business model is so Intro started with the guy who CEO of the Intro has already founded a B2B company. He has like a big short investors in his reach. He asked them to bring. He just gathered the top-notch people and formed a Intro. Minect. So Patrick David is a conservative. So he's like a Republican conservative. He is a big short politician on this thing. They formed like a tight-knit group, but nobody is tackling the affordability and actually like the people who they can guide well, but they are not influencer-centric. They don't have that much Instagram influence.
Okay, with 400K funding, how many experts you want to deploy for this?
So the 400 funding is mainly for the product development. So expert boarding does not take any course. So our model is simply this thing. We will charge on top of the expert price. We are not paying any expert. We are not taking anything from the expert. Expert says $100, we'll charge $15 on top of it. So if you ask $100, you will get $100.
Okay, thank you.
Nowadays it is very hot outside, right? Now imagine standing on a concrete road in Delhi. The air feels heavy, buildings radiate heat, and pollution index often cross dangerous levels. The very materials used for construction, bricks, concrete, steel, are environmentally dead. They emit carbon and PM 2.5 during production, but offer absolutely nothing to the environment. We have come up with a single solution for all these problems. Introducing SymBioBrick, a bio-based building material that can turn entire urban surfaces into air purifiers. We are using 3 natural components working together. Biochar from agricultural waste. It stores carbon, captures PM 2.5 and retains moisture. This supports the growth of lichen that can interact with pollutants like nitrous oxides. These layers are held together by a highly tensile biopolymer. The final result, a lightweight, low-cost, and self-sustaining solution. India's green materials market is rapidly expanding at an annual growth rate of 11%. India has an enormous construction materials market estimated over $255 billion US, implying even small market penetration represents significant opportunity for us. We adopt a B2B model targeting real estate sector like green building projects. Additionally, since biochar stores carbon permanently, we can generate potential revenue through carbon credits. Currently, there is no one dominating the market in India in this domain. Our competitors who are dominating the market and generating billions are in Europe. Therefore, we will have the first mover advantage. Our go-to-market strategy will involve a prototype and validation for the first 12 months. In the second year, we will focus on our initial customers who will be sustainability-focused developers. Once validated, we aim for long-term expansion. We are seeking 15 lakhs against 5% equity for pre-seed funding. Our vision is simple, to turn urban infrastructure into living, breathable surfaces. Thank you.
Okay, so you are going to replace the conventional material with your biomaterials.
No, we are not replacing the conventional materials with our biomaterials. We are integrating our technology with the conventional materials.
So what we are basically doing is like where we already have a cement concrete, right? So we are implementing our solution onto that thing. So it will generate a potential revenue, and we don't have to make it from the scratch.
Okay, so there is already a wall or a structure, and you are going to put your brick on top of that.
Yeah.
Not brick, like the layers.
Layers.
Yeah.
And what it will do, it will help in carbon, like it will absorb carbon. What it will do?
It will store carbon, like remove carbon dioxide from the air and store it in the biochar in the form of carbon. So we are essentially like removing atmospheric carbon and storing it, and it is stored for long time, like millions of years.
Okay, and what would be the cost of a single brick?
So a normal brick is around one brick is around 6 to 10 rupees. But we are we don't want to compete with a normal brick commodity. Since we are targeting the green materials market, so we will be competing with sustainable materials. So we will initially price it little higher, not to compete with the cheap bricks, but to compete with the green materials market, around 20 rupees per brick.
Now in lab scale, this all looks okay, but whether you have thought about commercialization, how it will happen, manufacturing setup and all?
Yeah, like for the first year, we are going for prototyping and validation. So the biochar, the lichen, and all these, they are actually separately. They are surveys which and they have been tested separately. So we will try to integrate all these together to we are engineering the science into one single product. So for that we need lab testing, and that is our first year plan, prototyping and validation. Once it is validated, we will interact with sustainable developers, like people who are focused on green building projects, and buyers who there are buyers who are who focus on green building and they are attracted by those. So there are sustainability developers who are interested in for these kind of models, because then they spend money for environmental beautification, aesthetics, but here we are providing both environmental benefits, and we are also attracting buyers for them through environmental sustainability. What?
Is this material inert to cement?
Yeah, it is not chemical interacting with cement. We are just putting a layer on it.
So how do you keep it intact?
So like I told, that these layers are held together by a highly tensile biopolymer. So the biopolymer which we will be using is fungal mycelia. So it is a specific species of fungus is there on which research has been done, and its mycelia is very strong. So it can bind actually the biochar and the lichen layer together.
And what about cement? How it will stick to the cement? You will put it on a wall, right?
We can use metal railing frames.
But that has a life shelf, 5 years, 6 years, 7 years, tops.
That fungal mycelia, it also has a short span of life.
No, we are actually heat treating it.
Oh.
So if it is heat treated, it is already dead. So it doesn't have a lifespan.
No, but for how much time it will withstand? Like it will be there outside. So normal brick can be there for maybe 10, 20, 30 years. But this brick, how long it will be there outside? Because it's a biopolymer. So after a period of time, it will degrade.
But there are literature studies that they have conducted and it survived. Like it doesn't often degrade, and it is water resistant also.
So instead of doing everything on your own, wouldn't it be great to collaborate with existing green materials company, because your product can be value addition to their existing?
So our materials are actually already researched on materials. We are just integrating them into the single product.
No, but instead of selling your product yourself, you can collaborate with existing green buildings material company who has a portfolio of products. Your product can be part of that portfolio, so that you don't have to go and actively get the customers.
That is for our second year plan. Like after we actually validate our idea, like through lab testing, then we will collaborate with existing green building companies.
Hello. So this banana looks perfectly healthy for me to have it right now. But none of us in the audience can tell that whether it has pesticide residues or not. Whether it has pesticide residues or not. India, with a population of 1.4 billion, And to sustain this production of food, pesticide is necessary and an inevitable tool to have. But having these pesticides on daily basis in the food itself is extremely carcinogenic, and there are a lot of studies out there which have shown, like I'm working in a neurodegenerative lab, and we have explicitly showed that this pesticides or the proteins or the harmful contents directly in the gut can directly affect up in the brain itself. So it's really important that we should be knowing that what we are eating. Right now, at the present stage, there are centralized laboratories which can detect these pesticide residues with the help of mass spectrometry, which is a 1 crore machine with each test of 10,000. So it's not quite possible for farmers, exporters, food processors to test it on the daily basis and provide it directly. Like if something is like organic fruits, like organic farming or something like that, we cannot go and tell that this is pesticide free. So my agenda is to make a portable colorimetric pesticide detector, which will be using selective reagent chemistry, which will give me a colorimetric change for each pesticide class. So pesticides are majorly divided into 4 classes: organochlorines, organophosphates, pyrethroids, and carbamates. And it will give me a colorimetric change for each classes, and then I can quantify it with the help of a phone or just a photodiode which is attached in the device itself. Right now, at this stage, I'm done with the complete literature review and the reagent identification. And with this, after this, we are going to go and test it in the wet lab and quantify all those things, develop the ML model for smartphone, and get the FSSI rapid analytical food test certification, such that we can just directly go in the market. Thank you. And sorry, I just got too tensed. So right now I'm done with all the reagents and all. I'll think like all this looks like 6-month target for me, because I know the reagents which are already there in literature, which are already like China has just made all these devices and all, and then the data is already out there. So I know what exactly chemicals I have to use or not. I'm not replicating those, but yeah, I know the chemicals. So I have to validate those, develop the smartphone model, and get the FSSI certification. So FSSI has made a particular conjecture where they have made possible for all this tests and all. So like you'll be able to see those milk tests and all at your rightly at your home. So they have made a conjecture where you can make this rapid analytical tests. Yeah, it will be a portable handheld device. So my agenda right now, so if you see it from a consumer point of view, I don't think a consumer would be daily going and then checking its food or not. It makes no sense. So the first agenda would be to give it to export houses. So if they have a batch of like 1 ton or something like that, they're giving it for mass spec and all. It will take time and it will cost them. They can just test it with this 50 rupees test, and they can just remove the major consumables. Then a major class over here is the way organic fruits and all these things are sold. A major class would be created by the food sellers and saying that these are pesticide-free food, such that one can go and just directly have it. Definitely it's gonna be there for end consumers, but that's not what market I look up to. Yeah. So it's me and Professor Srinivas Hota in the chemistry department. I did spoke up with few export houses and the Instagram influencers of all these things and how these things work out. So yeah, it's quite validated idea. Like it's just that we don't know what we are eating, and on the chronic stage, if you have an acute disease, you will directly be able to tell that, I'm having some someone put pesticide on me, I'm having a reaction. But on chronic stage, it is like cancer, neurodegenerative diseases, and we cannot just stop using it because we won't be able to sustain this much population then. Thank you.
So hi everyone, I'm Nikita and I have a startup named Enlage Material incubated in AIC SEED. I started my entrepreneur journey in 2024. Before that, in 2015, I have done my master's from IIT Delhi. And like any other IITians, I started working in industry, particularly in R&D and process development, and in majorly MNCs. And during that time, what I have found in all these MNCs, first, they were the European companies, so they were far ahead from us in technology viewpoint. They have a huge technological resources in their European offices. And in India, even though they have offices and manufacturing setup, they will not share the technology part. And being a technology person itself, I always wanted to explore those advanced things. And after a period of time, what I've realized that in India, all the major like advanced materials or biopolymers, it is coming from China or European countries. And in India, we are not good in manufacturing. We are more good in doing, the jugaad kind of thing. So taking multiple things here and there and then, customizing it and selling it in Indian market or maybe doing exports. And that was the point when I thought, as a technological person who has done all these research in its lab and done a lot of work, why I am working for any other country or their people, and I should develop all those technology within India. And with that purpose, after 10 years, I quit my job and started my own company. And right now, I am doing a lot of work in the field of biopolymers, which I can use for medical textiles. So I'm using different biopolymers to make fibers and then use it for textiles material which are used basically as a wound dressing or therapeutics. And I should tell you that most of the biopolymers still we are importing from the China. In India, these polymers are not available. And that is like the thing that maybe in future we are looking to develop these polymers also once we'll have the expertise. So what my main message to you all people that we are technology we have all that resources and we have that brain also. And maybe we should work more in the deep tech side, develop the products, do the manufacturing and make a India manufacturing hub, which we are not right now. So yeah, that is what my main message to you all.
Hi, good evening guys. My name is Amrit and I am the co-founder and CEO of Thermonics Energy Private Limited. My background is I'm a BE automobile guy, worked in the automotive corporate sector for a good 18 odd years, and then I had this burning desire to do something of my own. Ventured into the energy storage space, battery being one of the component of cars. We see that lead as a metal is highly toxic and not good for humans to inhale it. So we were looking for a tech wherein instead of sending it for recycling, can we extend the same battery life by another couple of years through some tech and process, which is what we do. We do something called as battery regeneration. If you see telecom towers, you go to these massive data centers, you see hordes of batteries being kept. Not all of them are bad. When the group voltage comes down, you replace the entire set because the OEM says so. So we have a technology and process through which we can extend the same battery life by another 2 years with guarantee, and we do this at 25% of cost of a brand new battery. So this saves money, at the same time reduces carbon footprint. I've been working in this territory for the past 4 odd years, and we have been awarded by MNRE and couple of other institutions like the Norwegian Embassy. We work in India and Africa right now because these are the two territories where battery is a hugely used resource, especially the lead acid one. That's my company background. Having come here, seeing the kind of tech and the thought process that you guys are working upon, it's feels really good to see that at that young age, you guys have this burning desire to do something of your own, such innovative ideas, much appreciated, right from food to tech to chemical, all of it. I wish you guys all the best. Just stay motivated. Entrepreneurship is not just a smooth sail. Don't give up too fast. Stay strong. And one thing I have observed in all the people, all the successful entrepreneurs, business people, is they stick to their idea. If the idea doesn't work the way they want, they pivot it. They go to some other part of it. Like in food, it doesn't happen. They'll work towards maybe not human, but the animal sector. So just small example. So stick to your idea, work upon it, have this burning desire to do something of your own. Entrepreneurship helps, it benefits in the long run. Salaries can give you some kind of stability. Wealth creation is always done in this, in the entrepreneurship side. That's all from my end. Thanks.
Hi all. My name is Rahul. I'm co-founder of 3R Solutions. What we do is, if you look at this water bottle, it's a packaging. We work on creating packaging that can be reused multiple times. So we work with paint, lubricant and adhesive company, wherein whatever packaging they are using, we collect them, clean, quality test and give it back to them for packaging reuse. What it does for them is it has a potential to save cost for them, reduce plastic consumption as well as the carbon footprint of the company. So this is what we have been doing for past 2.5 years. And thanks to AIC SEED, we have been able to set up our first factory in Pune itself. Thanks to funding and support of AIC SEED. That's what we have been doing. As far as tech is concerned, we have 3 IPs that have been granted and 2 are in process for our cleaning process and our product designs. So coming back to Amrit, you rightly said it's entrepreneurship is about patience, being at it for a longer duration. But there is a second part to it, which they might realize maybe 5-6 years down the line, which need not be discussed here at this moment. But what I generally see is confidence level is amazing. Like I feel at your age, I didn't had this much of confidence, guys. So this is wonderful to see so much of confidence. Also in few of the ideas, the clarity of thought was really there. And people have really thought through what exactly they want to do. So hats off to you. You are much ahead. At least when I was at your age, you are much ahead than me. And as Amrit said, keep at it. Stay with the idea, and all the best to all of you. Thanks.
Hi, good evening everyone. My name is Yogesh, and like all of you, I'm also a science student. I actually, though I'm not a student of IISER Pune, but I had an offer for PhD to join IISER. So I studied basically in Pune University for my master's. So I'm very much familiar with the environment that you guys are into right now. A lot of your professors have already taught me. So I'll just tell you a brief about my background. For my PhD, I went to Germany at the Max Planck Institute. I worked on basic chromatin biology. Then for my postdoctoral work, I did basically cancer biology. And today at Nucleovir, we are developing an oncolytic virus-based therapy for treatment of brain cancer. So by onco, of course, all of you know it's a cancer, and lytic meaning killing. So we are engineering cancer-killing viruses. So we are a team of, in today's world, I think one thing that I would like to basically mention is interdisciplinary science, holds immense edge. So in our team right now, we have an AI/ML person, we have a bioinformatician, structural bioinformatician, then a person like me, molecular biologist, basic biologist, and a virologist. So we are basically a team of 4 cutting-edge scientists put together, and we are a team of 20 right now, who are basically, each one of us are leading, in their edge, and we are collaborating to engineer this. So just want to say, in the spirit of IISER Pune, where you are right now, BSMS, where you have all STEM backgrounds. We have seen decks from biotech to fintech to environmental sciences, you know, and to all the way to phototherapy to engineering. So it's great to see that. Just want to say, you know, keep collaborating across hallways, across departments, because that collaboration, that hallway interaction is gonna be someday, you never know. I mean, it might create something for the world, for the betterment of the world, of course. And one advice, solve hard problems. Don't go for cheaper problems. Thank you so much.
Thank you, Yogesh, Rahul, Amrit, Nikita, for sharing your insights and enriching the community and this ecosystem. And really appreciate you coming here today and being the judges. Okay. So as suggested by Ashwin, first we'll share, as we said that for us, all of you are winners, right? So first we are going to give out the certificates to all the teams. Invite the jury members. And the second runner-up is Team Sasier. And the first runner-up, any guesses? Okay, I won't play with your emotions. Team Stratos. And the final winner of this idea pitch competition is Team Motorzyme. As I said before, for us, all of you are winners, and it was like a superb competition. We loved your energy, your enthusiasm, and we loved having you part of this event, and we hope to continue this further. I invite all the participants on stage for a group photo. Please come on.